When we look at Cape Cod's redesign, what really stands out is just how intentional they were with every decision. Nothing happened by accident. First, their purposeful, task driven layouts came straight from watching how real patients were using their site. During their discovery phase, they noticed that mobile visitors were almost always trying to complete one of just a few key tasks. Things like finding urgent care wait times or checking hours. So instead of burying those actions, they moved them right to the top of the mobile experience. They designed those high priority action cards on purpose, knowing people make quick decisions on the go. And for things like urgent care wait times, Cape Cod chose to surface those prominently because they knew patients were often in decision mode. It wasn't about aesthetics, it was about reducing friction in moments that mattered. Second, their move toward controlled content density was a deliberate shift away from long, overwhelming mobile pages. Cape Cod took a hard look at their existing content and realized most of their pages were text heavy and require a lot of scrolling. So during the redesign, they broke information into shorter, scannable sections. This wasn't just a content exercise, it was part of a strategy to reduce cognitive load for mobile users. And they applied consistent patterns across pages so users wouldn't have to relearn the structure every time. Instead of embedding full interactive maps, they chose to remove the embedded maps entirely. They now display simple, fast-loading options, a link to get driving directions, and a link to see a map. This approach keeps the page lightweight while still giving users exactly what they need. Overall, Cape Cod's redesign wasn't about adding more, it was about adding intentionality. They made every decision with a specific purpose: make tasks faster, reduce friction, and support patients during moments when clarity and access matter most. So ultimately, improving findability isn't just a UX enhancement, it's a critical access to care issue.
So again, how do we fix it? Fixing poor findability and getting people to your doctors and locations takes a few strategic steps. First is make doctors and locations easy to reach. As Emery just showed in our example, and as we talked about earlier, data across the industry shows that people are looking for doctors and locations most of all. Remember those rural stats? That's where these really play in. Make sure it's easy to get to those pieces of information from your navigation or through other variable design elements on your homepage on your mobile device. Improve location profiles with information that people want. If you have multiple locations, they're likely a little different. When building location profiles, focus on information that's unique to that location: parking, visiting hours, dining options, and so forth. And ensure each doctor and provider has a profile on your website. Content needs to be findable beyond your website. Having a location profile connect to Google locations, having provider profiles with ratings and reviews. Don't forget the rise of AI, where people are using long tail keyword searches and terms to find more specific information for the search they're looking for. That includes your doctors and locations and treatments. So connect all of your locations to Google My Business for added map enhancement. And as always, test with real people. We say this a lot, but it's important that you understand what real users are looking for. And when in doubt, it's a great time to ask.
Enabling geolocation streamlines search even further, automatically showing nearby clinics, doctors, or services without users having to dig through menus or manually enter their location.